All right, guys, part two, the infectious disease and sepsis, and we're going to get more into the assessment part at this juncture. Again, we talked about making sure that we have everything good. We know what the bad, icky, what things that cause infection. We also now know make sure that we're prepared for that. If it's wet, gooey, and not ours, we don't touch it. Okay. So again, so how do I know that this patient is infectious? Well, you can take the shotgun blast of everybody's assumed to have an infection until proven otherwise. And I think that that's not necessarily a bad route to go, okay? Look for general indicators for infection. They're what is it that they say is wrong? Do they have a fever? Okay. Again, patients who have AIDS or taking immunosuppressants, they're very susceptible to infection. Cancer patients, very susceptible to infection because, again, they kind of destroy their immune system in the process of treatment. Okay. So, again, and what about other disease processes, drug users, alcoholics? Again, all of these guys can be these that their immune system doesn't work like they're supposed to. Okay, so again, go in. Let's get our vital signs. Let's get it again. If we feel that the skin is hot or cold, for that matter, yes, you can have cold sepsis. Again, in hypotension with infectious diseases may result because, again, they get dehydrated. They start to vasodilate. Remember that inflammatory response swells everything out. And if it swells everything out, then, well, guess what? It's going to swell out the blood vessels. It's going to cause a relative hypovolemia, okay? Which is why we treat that with aggressive fluid therapy when we do find, especially when we see signs of end organ failure. One of the biggest things that we can do is to start to fill up those pipes, okay? Skin temperature, hydration, again, sclera, again, check for jaundice. Again, these are all things, the signs of some sort of infectious disease going on, okay? Again, do we have the swollen neck glands? Do we have where they're wheezing or they've got rhonchi, that nasty yuck in the bottom? Do they have a pneumonia where they're pleural rubbing, we hear? Or worse yet, you start getting leakage into the alveolar spaces where you get crackles, okay? Do we have pus-filled lesions all over the body, okay? Is their liver bigger than it should be? All these things we need to check. Again, if I'm feeling down the bottom, the top right of the abdomen, and I'm feeling the liver because it's that pronounced, hello, we've got a problem. Okay. HIV again. The biggest thing is they get opportunistic infections, things that we normally wouldn't see in a standard patient. Tuberculosis. When you get and I'm not going to go too deep into the HIV stuff because we've already talked about this already for 2 hours. So remember that, again, there's all kinds of HIV types, and again, it has to do with the T4 cell count. And again, we want to, but again, it destroys their immune system, and because it destroys the immune system, then they can't respond to the simple common cold. Okay. How do they get it? Again, it can go through some sort of blood or body fluid, and yes, it can go through breast milk, okay? But it is commonly contacted through sexual contact or sharing of the needles, okay? Again, I'm kind of going to fire through these guys, but I do want to kind of bring up Kaposi sarcoma. This is where they get the cancerous lesions that are very rare in a normal person. When they have HIV, however, they usually get these all over. They get these purplish lesions all over their body. Okay, and again, if you see these, be very suspected that it's probably some sort of HIV issue. Again, it can happen to other people, by the way, but it's again very rare. It's usually because the immune system has been destroyed. I don't want to go too far into the HIV stuff. We've already talked about this a lot. But let's talk about some other communicable diseases for these guys. And hepatitis, again, you get swelling of the liver. Again, these can be bacterial, fungi, viral infection, parasites. If you drink too much, newsflash, you can get hepatitis. All right. So again, the biggest thing is they can get a fever, they get weakness. Remember, that's your filtering organ. Okay. So again, nausea, vomiting, right upper quadrant, abdominal pain is another thing that can happen with these guys. And there's all kinds of hepatitises. The A, by the way, is usually the fecal oral route. the other ones are usually it requires bloodborne transmission. The incubation period is about 3 to 5 weeks. So especially if you get an exposure, you really need to document it. If you get a needle stick, you really need to document it, because what happens is 6 weeks from now you start getting sick and everybody goes, wait a minute. So that's the reason why you really need to do that, okay? Again, hepatitis B is much more contagious than HIV. Again, and it will sit on a counter surface, by the way, guys, for 3-4 days. So make sure that you do good decontamination, and that's why you want to use some sort of virucide agent or a bactericide agent to make sure that you're killing these hepatitis B germs off of your equipment, okay, or where a patient might be or a patient might sit. Again, the thing is of immunizations, by the way, even though you're immunized, you can still get it, okay, but usually it takes some sort of body fluid, but it is actually a lot more. HIV, if I was to hock up a loogie with HIV on it, probably within 2 minutes it would die on the counter. This stuff, hepatitis B, will sit there and live for a very long time. Okay, I'm talking days, up to weeks, actually. So keep that in mind when you're dealing with it. Usually, at the time of the infection, you're usually asymptomatic, but again, the incubation period on this can be up to 6 months. Okay, hepatitis B, again, is usually transmitted through IV drug use or sexual contact, and again, it usually creates the chronic conditions. It swells the liver up. The good news is all of your hepatitis usually give you the same set of symptoms, okay? So, again, in the treatments, and I will tell you that the Hep B, my understanding of it is that it actually is rather effective, but they use the antiviral drugs being used as a result. They've been mixed, and they've had some fairly decent success with that. Again, the only thing I really want you to know, again, the D usually is a bloodborne. E is actually the fecal-oral route, and it's usually drinking the contaminated water is the big one that they get that one from. Again, not as bad a cases with that. Tuberculosum, Mycobacterium tuberculosis complex. I would probably know that word for my quiz somewhere because I'm fairly certain there's a question about that there. But it affects the respiratory system, okay? And what it does is it kind of, if you've ever seen somebody with an x-ray of this stuff, they've got little lesions all over their lungs, okay? And it destroys it's the bacteria that actually destroy lung tissue. There's respiratory droplets, and one of the things is you get a lot of coughing with these patients, and you'll hemoptysis. You're going to have them spitting up blood with it. Okay, and again, most agencies, again, they usually test you guys annually. This is the one of the few times we actually do the intradermal injection that we taught you guys back in class. So it's actually to do the skin TB test. Again, the incubation period for these guys can be 4 to 12 weeks. So again, if you've got somebody that had a TB, you need to make sure that your infection control officer knows that, hey, I had a patient with TB. And more importantly, make sure that you are wearing your mask during this time. And that would be an N95, by the way. Again, your HIV people, by the way, because they have a compromised immune system, most of the time, us uncompromised folks can take care of tuberculosis pretty easy. But by the way, you can get tuberculosis not only in the lungs, but it can spread to the meninges, and it can spread to the brain and the nervous tissue. Okay, so just be aware that they can do that. Okay, the biggest thing is the chills, fever. They got fatigue, chronic cough, weight loss, and night sweats are the big ones. Okay. If you getting caught spitting up blood, expectorating blood, hacking up blood, think TB until proven otherwise. Okay. Again, make sure that you've got your mask on. Make sure that it's an N95. You want to make sure. You probably should cover the patient. I would recommend oxygen therapy via mask is a good way, but you need to have the patient masked as well with this. Again, make sure you got an N95 on. I can't stress that enough. All right. Again, ventilation systems in the ambulance recycle and filter the air, but make sure that those filters get changed out. Okay. You don't want to keep them there. Your pneumonias, again, these guys, uh, we go to a lot of patients with pneumonia, and there's so many different causes of pneumonias, but they spread usually via droplet infection, okay? So again, this is one of the reasons, by the way, when COVID first came out, they were so emphasizing the mask, is because it prevents the transmission of the droplets, okay? Now, part two to that, make sure you're wearing a mask that can actually stop the droplets. And everybody's got to wear the mask for that to work. So if everybody's not wearing the mask, it doesn't work. Okay? So, but again, if you stay 6 feet away, it's really hard to get those droplets out. Usually they will dissipate before that. But if they're, actively hacking and coughing, that's where the problem's going to be with this, okay? Again, make sure that you support oxygenation and ventilation. Remember, guys, this actually affects the alveolar level and the gas exchange, okay? So you got to be aware of that, all right? And then there are vaccines against pneumonia. They have, again, it's highly recommended for the ages of 2 years. Those without spleens, by the way, definitely is a good thing. And EMS workers, it's not really a necessity, but as far as your flu shot, I'd say that probably those are a pretty good one. Now, speaking of COVID, and actually SARS is a earlier version of the COVID. Okay, so notice how it says COV on here. I wonder why it says that. Because this was one of the things. And by the way, there was a huge scare when SARS MERS came out initially, because it was going to come across and it was going to kill us all. Okay, and well, again, the problem was that your incubation period was 2 to 14 days with SARS, and they had to quarantine at home for 10 days. So that's kind of where your 10-day thing came in, because this was a recommendation actually left over from the SARS period. I wonder, huh? So again, make sure to get your PPE on, and as a matter of fact, when we first had the SARS and truly had SARS cases, we started out in level C suits, actually. And you would have a PAPR on, or air purifiers, or again, you would have an extended PPE on and present. So again, this is a SARS outbreak. It was initially in 2002, and again, the biggest thing is that it stopped. It was a bad case of the flu in the case but it was causing respiratory failure. This sounds vaguely familiar. Okay, so again, the problem is treating this patient with oxygen. Remember that it's interfering with the gas exchange at the alveolar level. So it's probably not going to correct your hypoxia, and that's one of the biggest issues that we're dealing with these guys. We're dealing with the COVID patient, actually, or even a SARS patient or a MERS patient, is that it's going to be very hard. And again, the big flipper with the COVID stuff was that if you intubated these folks, it was kind of a death sentence for them, okay? But when they reached that point, ventilatory assistance is probably going to be necessary. So your SARS, your MERS, you're going to have to do this. And again, the mortality rates, by the way, for MERS was 30 to 40% is what they were projecting. I think that those numbers were actually in reality a little bit lower. But again, it's usually because they had pneumonia, which then they went into end organ failure, which is what ended up killing them. Okay, so again, your Ebola. These guys are transmitted between people. It's usually through broken skin, and in the 2 to 3 days up to 3 weeks after an exposure. And it was usually the biggest thing about recovering from the Ebola is you got to keep them hydrated, and you got to maintain their O2 sat. And but again, we were actually isolating these patients, and this would be an example of the Ebola disease. But we were actually, making sure that we surrounded these folks. Chickenpox. Again, this is the varicella zoster, which is, by the way, related to the herpes zoster, which is the shingles virus. Again, it causes very painful skin lesions. The little pustules form with that. And kids usually get it. It's not too bad. When the adults get it, we got some major issues. Again, malaise, low-grade fever, rash everywhere, and the bumps go everywhere. They itch like crazy. Calamine lotion is really good. Once they actually form small ulcers and scabs, then you're no longer contagious. They just itch like crazy, and then you have to wait, and then eventually those will fall off. So this would be an example of the chicken pox. These little whelps, they eventually pop, they scab over, and then again, calamine lotion, warm oatmeal soaks are actually really good to help speed that little process along. But again, the biggest thing though is this is actually an airborne virus. So good chance if other people haven't gotten it in the house, they're probably going to end up getting it. Okay, and an adult, the problem is they end up getting pneumonia, and it will and these things go everywhere. There is crazy, and they get dehydrated. They start losing their saturations. It gets really bad. Okay, there is a chickenpox vaccine though, Varivax. Again, a little bit of controversy about whether it works or not. Again, I remember that I didn't have to have it because I had already had the chicken pox. But again, remember this, and I will tell you this: I did get the shingles vaccine, and I was one of the 3%ers that got shingles. Okay, so just because you have that, it doesn't give you 100%. They even said to me, "Well, there's a 3% chance you might get the shingles." Well, congratulations, I'm a 3%er. All right. Again, observe your standard precautions, guys. If if the patient has had chicken pox, remain at home until the lesions are crusted and dry. That again, if you're exposed to chicken pox post the vaccination, yes, it may be warranted for these folks. Check with your infection control officer with that. They do have the ability to get that to you. Your meningitis, guys, and this is probably the last one that we're going to be going over in this particular video. Meningitis, the irritation of the meninges of the brain. These guys gets into the cerebral spinal fluid. It's usually bacterial or viral. The one you don't want is the bacterial. Again, it turns into spinal meningitis. Is a great, if they have that, extremely contagious. Okay, and then the 90% of the patients, by the way, have viral meningitis. That's kind of the good thing there. And it peaks in the midwinter months when the temperature and the humidity is low. And again, the incubation period is about 4 to 10 days on this guy. Again, neutral rigidity, fever, chills, really bad headache. Really just don't feel good. Changes in their mental status. These are all signs and symptoms of meningitis, okay? And you can get a rash that appears in the petechial rash all over, usually in the bigger skin areas, especially around the back. Again, you can get a fever. They need to be double checked, especially in newborns, that they do not have meningitis, okay? Brudzinski sign, you might need this. The flexion of the hips or the knees when the neck is flexed is considered positive. So bring their knees up, bring their hips and knees up to their chest, turn their neck a little bit, and if they're complaining of pain in the neck and the back, that's usually a pretty good sign that they got it. If their head cannot extend their knees due to the meningeal irritation, it's usually a positive Kernig sign, okay? So again, the way that I usually do it is I take and I flex the hip and I flex the knee. If they can't move it, yep, I'm good enough with that. You got good Brudzinski sign, the Kernig signs, and you're going to go no, okay? But there are vaccines available for this guy. So again, maintain your standard precautions, guys. Make sure that you're masked. Make sure that you're masked. I would probably put my gown on. And again, post-prophylactic exposure, usually they put you on some sort of regimen of medication, antibiotics. If it was bacterial, they will do that. And at this point, no, we got a few more to go. Some other airborne disease, guys, is, again, rubeola, measles, mumps, RSV, all the pertussis, the whooping cough, okay? So all of these are airborne. Again, make sure that you get your mask on when you got these things. Any type of fever that the patient has, a mask is a really great idea, especially when they say that they know that they have one of those diseases. Again, influenza is our other big one that we're going to go over. There's all kinds of strains of influenza. Again, they changed the flu shot. Do they really know which flu shot works that season? No, it depends on which one's going rampant at the time, okay? Most of the time they get it right. Every now and then they don't, okay? And again, it causes the pneumonia. That's the biggest problem that starts causing the epidemics. And again, it's easily transmitted in a crowded space. And by the way, that's why I call the ER the cesspool during the winter, because again, 3/4 of the people out there have some sort of influenza with them, okay, that are sitting in the waiting room, okay? And again, more serious for the very old, the very young, and those with underlying diseases, diabetes, heart, high blood pressure, your heart conditions. Okay, usually it's a 1 to 3 days. About day 3, you start getting the fever. You get the body aches, the pains. It can develop into pneumonia, and it can actually start causing hemorrhagic bronchitis, and it can cause death in certain cases. Okay, so you get your hydration on early, begin that, and then everybody is susceptible to influenza. I can't stress that one enough. Make sure you're wearing your mask. Dr. Jones, we used to make fun of him all the time, but during flu season, he wore the mask. Every patient, every room, and everybody giggled, but the guy never got the flu. Okay, I'm just saying, it's not a bad thing to do. And then again, the last one we're going to go over is the common cold, a simple viral rhinovirus. And again, usually the best thing to do is wash your hands with this, guys, and then you're probably not going to get a fever or any type of muscle aching usually with this. Usually a diphenhydramine works really good. Pseudoephedrine is another one that's a really good over-the-counter drug to help with these, just dry up the nose, okay? That's going to do it for this session, and we're going to talk on the next one about the other types of communicable diseases, so I will see you guys then.